Ever get the feeling like everyone's dealing with some kind of mental health thing these
Yeah.
days?
Oh, yeah.
It's like you can't scroll through social media without seeing something about anxiety or burnout
Oh,
or
yeah, everywhere.
yeah,
Yeah.
and it makes you wonder, like, is this a new thing or have we just gotten better at talking about it?
It's a good question.
Yeah.
I think it's probably a little bit of both.
Right.
But the stats definitely show that mental illness is incredibly common.
Okay, so let's dive into this.
Let's do it.
We found this podcast script titled, What is Mental Illness and How to Seek Help?
Catchy.
And we thought it would be the perfect jumping off point for a deep dive
Absolutely.
into this topic.
Yeah.
You know, cut through the noise and figure out what really matters.
Get to the heart of it.
Exactly.
Yeah.
So first things first,
Right.
what exactly are we talking about when we say mental illness?
Well, the script makes it clear right off the bat that this isn't just some fuzzy feeling, you know?
Oh, definitely not.
Like, oh, I'm feeling a little down today. We're talking about actual medical conditions.
Huh.
Conditions that affect your mood, your thinking, your behavior.
It's like the brain version of a broken leg or something.
Exactly. It's a health condition, just like any other.
And that's a huge LD point
It is.
because it helps break down that stigma
Oh, for sure.
that so many people still have around mental illness.
Yeah, like if you had a heart problem.
You wouldn't be ashamed to go to the doctor.
Right.
So why should it be any different for your brain?
Exactly.
I mean, think about it.
Okay.
Depression, anxiety, bipolar disorder, schizophrenia, eating disorders
These are all serious conditions.
that affect millions of people.
Millions.
And the thing is, it's not always obvious,
No,
right?
not at all.
Like someone might seem totally fine on the outside.
But be struggling internally.
And I think that's why this whole recognizing the signs thing
Oh, yeah.
is so crucial.
Absolutely crucial.
So let's get into that.
Okay.
The script lays out a bunch of common signs,
Mm-hmm.
like persistent sadness or worry.
Right. Those are the classic ones.
Yeah. But then there are others that are maybe a little less obvious,
Like what?
like changes in appetite or sleep patterns,
Oh, yeah. Good cat.
difficulty concentrating.
Withdrawing from social activity?
Oh, and substance abuse.
Right. That's a big one.
And, of course,
Uh-uh.
suicidal thoughts.
Okay. So those are serious red flags.
Absolutely.
But here's the thing.
What's that?
We all feel sad or anxious sometimes.
Oh, yeah.
So how do you know when it's crossed that line from, normal to concerning?
Right. Good question.
Well, it's all about severity and impact.
Okay, explain that.
So, like, if you're feeling down for a day or two,
Mm-hmm.
that's probably not a big deal.
Yeah, we've all been there.
But if that sadness is lingering for weeks,
And it's starting to affect your work,
your relationship,
your ability to function.
right, then it's time to pay attention.
And I think the same goes for like those less obvious signs.
Absolutely.
Like if you're suddenly sleeping 12 hours a day,
Where you can't focus on anything.
you're snapping at everyone.
Those are signs that something might be off,
And this is where seeking help comes in.
which can be really hard.
Oh yeah, it can be super intimidating,
For sure.
especially with all the stigma we were talking about earlier.
Exactly. People might feel ashamed.
Embarrassed.
Well,
Or like they should just be able to handle it on their own.
but the truth is,
Yeah.
asking for help is a sign of strength.
It shows that you're taking care of yourself.
Exactly.
So the script walks us through some steps for seeking help.
Okay, break it down.
First, educate yourself.
Learn about mental illness.
Its causes, its treatments,
The more you know.
the less scary it'll seem.
Then confide in someone you trust.
A friend, a family member, a teacher,
Anyone who can offer support.
and listen without judgment.
Yes, that's key.
Okay, then what?
See a professional therapist.
A psychiatrist?
Someone who can diagnose and treat your specific condition.
Because mental illness is not one size fits all,
Right. There are so many different types.
and different approaches to treatment. So finding the right professional for you.
Is super important.
And the script also mentions joining a support group
Oh, yeah, those can be amazing.
because they provide a sense of community.
And shared experience.
You realize you're not alone in this.
And that can be incredibly validating.
Okay, so we've talked about recognizing the signs.
And seeking help.
But before we wrap up,
Yeah.
I want to circle back to this whole stigma thing
Okay.
because it's like this underlying issue.
That just keeps perpetuating the problem.
Exactly.
So how do we break it down?
Well, the script emphasizes the importance of normalizing conversations about mental health.
Talking about it openly and honestly.
sharing our own experiences.
Challenging harmful stereotypes.
Like the idea that mental illness is a sign of weakness.
Or that people with mental illness are dangerous.
Those are just flat out wrong.
And incredibly damaging.
Because they prevent people from seeking help.
And from getting the support they need.
So we need to create a culture where it's okay to not be okay.
Where it's just as acceptable to talk about a panic attack
as it is to talk about a broken arm.
Exactly.
Because mental health is just as important as physical health.
Couldn't have said it better myself.
So as you continue to learn about mental illness,
and hopefully this deep dive has been a good starting point,
I want you to consider this.
Okay, I'm listening.
How can we, as a society,
create a more supportive environment
for people struggling with mental health challenges?
Is it about more funding for research and treatment?
Is it about changing the way we talk about mental illness?
Or is there something even deeper we need to address?
Something about the way our society is structured.
That contributes to these challenges in the first place.
A complex issue.
But one that's definitely worth exploring.
Absolutely.
And talking about.
So keep the conversation going.
Don't be afraid to ask questions.
And to reach out for help if you need it.
Because you're not alone.
Not at all.
And there is hope.
Always hope.
Always.
And on that note,
I think we've covered a lot of ground today.
Yeah, this has been a really insightful deep dive.
I agree.
So until next time.
Stay curious.
And keep learning.
Bye.
Bye.